MOPHAR – Better Care for Mental Health Issues. The numbers don't lie. Life expectancy for people suffering from severe psychiatric illnesses is 13 to 30 years shorter than the overall population. This is often because people with mental health issues also experience physical problems. These may be caused by a person's unhealthy lifestyle, resulting from their psychiatric illness. But they may also be caused by the side effects of psychiatric medication. We can help clients better if we look not only at the mental health issues, but at their physical problems too. And by measuring clients at the start of treatment, we are better able to track the effects of medication and respond in time when necessary. MOPHAR consists of two parts. On the one hand, it is a new working method designed to improve the standard care for individual clients, and on the other hand, it is a research project to find out more about the physical effects of medication and the accompanying care. The most important questions are: how can we make care more efficient by detecting relevant signals while performing fewer measurements? Are there specific client traits that predict whether a particular medication will be effective for them or cause side effects? We can use the results of the research to improve treatments, for example by detecting side effects sooner or selecting the most appropriate medication. How does it work? After a client has been referred, he or she fills out an extensive online questionnaire. Next up is an initial consultation with a nurse who performs a brief physical examination and takes a blood sample. The nurse also asks the client about their lifestyle and whether they or their relatives have any physical conditions. In addition, the nurse asks the client's permission to use their data anonymously for the research part of MOPHAR. The nurse then enters this information directly in the client file, along with the precise medication the person is taking. This is an area that still needs a lot of improvement. Practitioners often don't have a good overview of all the medication a client is taking at any given moment. To remedy this, the nurse sits with the client and reviews a printout from the pharmacy together with all the pill boxes the client brings from home. This is also a good opportunity for nurses to use their clinical expertise. The client's next stop is a first interview with a psychologist or psychiatrist who accesses all the information collected in the client file with a single mouse click. This leaves more time to talk about the client's mental health problems. 1 or 2 weeks later, when the results of the blood test come in, a multidisciplinary meeting takes place. From a variety of professional perspectives, we take a structured look at the collected information in order to recommend a treatment. MOPHAR always includes a discussion of the physical component too. In other words, we take a wider perspective on the client's issues. This is useful for the professionals. They get more information and are able to offer better help. A week after the multidisciplinary meeting, we meet with the client to discuss the recommended treatment, and, if necessary, the client starts taking medication. We have compiled protocols for each psychiatric medication based on existing guidelines. These specify how often a client needs to be tested for side effects. For this to be effective, clients need to be tested 3 to 5 times in the first year. Less often after that, but at least once a year. The family doctor is informed about all results. To make implementations of the screenings practical, MOPHAR nurses receive computer notifications whenever a new appointment needs to be made. In the meantime, we are working towards closer collaboration with others in the healthcare chain to streamline care such as that offered by family doctors and mental health care. We also want to work together with nurses to develop standard interventions for practical conditions, so we don't have to keep reinventing the wheel. With the contribution of nurses and doctors to MOPHAR, we can improve care for clients quickly and effectively, and that is exactly what they deserve.